Hi, I'm Dr. Ravindran, sports surgeon, especially a knee surgeon in Coimbatore Bone and Joint Foundation. It's in Coimbatore in South India. I got trained abroad in UK, New Zealand and Australia, and I returned to Coimbatore, mainly with an interest of knee surgery, knee sports injuries. Now what I'm going to concentrate now is on the meniscal aspect, the meniscal surgery and meniscal aspect. Now meniscus, what is meniscus? I'll show you with the model first because you have to understand what is a meniscus first. Now these ligaments or these meniscus are shock absorbing units. I'll show you that. That's a knee there. And I'm just going to focus on that very closely. It looked like a C-shaped ones. Look at this one. The C-shaped one. That's like that one and this one. It's like a letter C in the English letter C. Forget about that one, which is the anterior cruciate ligament. So this C and this C there. And you see all the blue color ones. The blue color is articular cartilage there. Now what we are talking about now is a meniscal, starting from the front there and goes all the way through the back. And that's how it's quite a big one. It's about that size in normal life. It's about that size. You see that? That size. And it's pretty heavily attached in the front and the back of the knee joint. Now these are shock absorbing units. Once the meniscus is damaged, the knee is going to be permanently almost like, I couldn't use that word, but I will use that, it could be doomed. It's very, very important that the meniscus is retained for life. And this injury can happen in what I have in the practice is mainly from, the cricket players, from volleyball players, and from basketball players. And kabaddi now the new pro kabaddi things is coming up. All these fellows can have a damage to the knee joint. They have a twisting injury of the knee joint. One small twist in the wrong position can damage the ligament. And most commonly what happens is the medial meniscus gets more damaged than the lateral meniscus, more commonly damaged. So small tears can be left alone, but if it's a bigger tear, various types of tear. It's a vertical tear, it's a radial tear, it's a peripheral tear, tear with a dislocation, tear with a extrusion. All these things can happen. What is happening is one type of treatment was done in the past. That is, do a meniscectomy. Now that is not in the books anymore. A meniscectomy is not the procedure for meniscal tears. Whatever is torn, we have to stitch it back. Whatever is torn, you can't throw it away. You can throw a torn paper, but you can't throw away a torn meniscus. Meniscus has to be retained. It's very important the meniscus has to be retained. As I told you from the beginning, it's a shock absorbing unit. You can't just take it away. It has to be retained. And what we do now is what they present with an instability, the patient usually present with instability, like giving way, like pain. Pain can be sharp, there can be swelling, it can be localized tenderness, they can feel an unstable joint. All these can be happening. And you can confirm with an MRI. And the procedure that usually done, if it's a small tear, obviously you can be left alone and physiotherapy and exercises will improve. But if it's a bigger tear, the situation is different. And it's a small hole by keyholes, by arthroscopies. 2 or 3 keyholes can be done by arthroscopic methods, and you can fix the meniscus. Whatever is torn can be stitched back. Next day the patients can walk. It's important that the patient can be done under either a local or regional anesthesia. It doesn't need to be GA at all. It's just a regional anesthesia. And the next day the patient, even the same day, can walk, but the next day they can start walking. But if the meniscus is repaired, it is usually a bigger tear with the blood supply retained. We try to retain the meniscus, and we have to put some small implants. Right now what is available is all biocomposite materials which you can put inside and you can stitch it back. And once it's stitched, of course, the patient will be able to walk the next day. But the only thing they have to avoid, taking weight for some time, and also to avoid sports for some time. Normally we avoid sports for about 6 weeks to 3 months. And after that, it's usually joined up and they get the integrity properly and they get the strength properly. Once the meniscus is repaired, as I told you, their strength is retained. We have hundreds of patients who have undergone repair recently in the last few years, and they do very well. The arthritic changes comes down dramatically, or the arthritis doesn't develop at all because the meniscus is rectified. So there you can save a knee joint from a disaster. As I said earlier, once it's repaired, once it's done, once it's rectified by all these keyhole surgeries, they're going to be fine. They can get back to their normal activities, but their daily living activities, and to their normal sporting activities. Thank you for watching video on meniscal surgery.